In today's day, especially in after post-COVID, if I were to say, the disruption that COVID has caused globally, it is essential that we have disruptive innovation. We cannot go on the way we have till date, because clearly we were ill prepared to handle a crisis such as COVID. We may well say this was a pandemic, but it showed a lot of gaps in every country's health system. Going forward, principally the disruptive innovations, if they start in addressing a continuum of care for patients, especially with NCDs, against urgent issues, it will be a huge step forward. With confidence now in wearables, in people realizing that they have to be responsible for their own health, I believe there is a huge sea of opportunity which can be tapped into making healthcare truly fitting an individual's needs rather than being on a broad base. If, on the other hand, if you were to ask me, in India, what is it that we need to look at with depth and detail, given our challenges of providing care for 1.4 billion people on one hand, and on the other having our stupendous success in the vaccination rollout problem, are threefold. Number one, we really truly have to be in a position to have universality of access to affordable quality care. This can only be done if we harness the power of the digital platform which has so far been unleashed. The second most important point is recognize the stellar work that community health workers, individuals and stakeholders other than what the doctors and nurses did are mainstreamed in a continuous fashion and not an episodic. Lastly, as far as healthcare providers are concerned, that is the doctors, the nurses, the hospitals, there's an urgent need to look at task shifting as well as upskilling all healthcare workers. This is not going to be the last of a pandemic. They're going to come faster as well as more frequently. The only way we can manage it is by empowering the consumer stroke patient and further empowering and task shifting.